Employer-based coverage is by far the largest source of health insurance for the non-elderly, with 158 million enrolled in employer plans. While the Affordable Care Act improved coverage options for those without a job-based health plan, employer-based plans have been neglected. Unfortunately, this consists of the majority of the population, with the remaining 25% either enrolled in Medicaid or through the individual insurance market. There are no existing subsidies for employer-based plans unlike Medicaid, thereby exposing these individuals to high costs. Subsidized coverage proves useful, as it allows families to save more money in premium contributions and cost sharing. Recently, there has been interest in proposals like Medicare for All and options for employees to buy into Medicare. Certainly, this would allow for considerable financial protection across the income scale for full-time workers. As income inequality is on the rise, healthcare inequality becomes more apparent because the extortionate cost of healthcare prevents individuals from being able to afford their care. Healthcare expenditure in the US grew highly concentrated as it is dominated by the top class of society. In fact, the top 5% of spenders account for almost half of spending, which accumulates to $623 billion. However, people with lower incomes are left to spend a significantly higher share of family income towards premium contributions and out-of-pocket medical expenses. Based on surveyed individuals, there is no surprise that people are having a hard time affording health insurance due to it frankly being too expensive and lack of savings on their part. All this adversely brings income inequality to the rise in the United States. The growing income gap between the rich and poor favors rich people, and the situations for poor people become even worse as healthcare becomes increasingly expensive. For certain populations, they are easily able to afford the care compared to underprivileged populations who struggle to afford an essential need vital to their physical well-being. This gap of financial capital will only continue to become wider if the trend continues and will result in worse health outcomes. Unfortunately, further disproportionately affected populations exist within the poor demographic. Due to the high cost of healthcare, African Americans among minorities are unable to afford healthcare and worsen consequences for the health problems and can even lead to racial injustice. These raise questions for our political policies and initiatives. In fact, healthcare policy is a key factor people look for when voting for presidential candidates. This is a result of difficulty paying for healthcare and seeking to see reform within healthcare. If an individual desires and supports lower healthcare costs, they would prefer voting for a certain candidate than voting for another candidate of another party. But regardless, this is a comprehensive issue that involves many categories of health policies: global health policy, public health policy, mental health policy, healthcare services policy, insurance policy, personal healthcare policy, pharmaceutical policy, and public health policy. In the next video, we will explain the severity of healthcare affordability in America.